Hi everyone. So I had a surgery yesterday that I honestly was not planning on having, but it happened. I had hiatal hernia repair and a LINX put in. It was really a result of my um, gastric sleeve and my hiatal hernia that I had before I even had the gastric sleeve, and the significant amount of reflux that I have been having over the past several years. Been on pantoprazole, which is Protonix, a PPI that helps to lower the acid in your stomach. And I've been on it since 2016. And it's starting to no longer help. And my stomach just doesn't like it. I gain weight on it. Um, Basically, it was just getting to be too much. So I went to a surgeon who also took out my gallbladder and does bariatric surgery, although he didn't do my surgery. And we did a Bravo test. We did the manometry a couple years ago, prior to my gallbladder being taken out. And basically found out that I had some of the worst acid reflux that he had seen in his time as a surgeon, and that I was an excellent candidate for the LINX. And I had a bad hernia that needed to be repaired, and better to do it sooner rather than later to risk erosion of my esophagus and the potential side effects of the PPIs that I was taking. So, long story short, my Bravo test was done in February, and they had an opening for surgery this past, well, yesterday. I found out just about a week before that I could do it then. It worked out, and here I am a day after my surgery, and they repaired the hernia and placed the LINX. Now, the LINX is a magnetic band that's placed around my esophagus that basically stops the gas, or not gas, the acid from bubbling up into my esophagus. I didn't have that luxury because I had the hernia, and because I had um, just a weak um, lower esophagus, that acid was just coming right back up, and it was hurting. It was going through my back. And pretty much the best thing for me was to get it taken care of. So I have that band. So what does that mean? Well, it means that it can stop the acid, but it also means that I have to be really careful now when I'm eating, to make sure I eat slowly. I chew a lot. And for the next several weeks, I need to eat every hour and a half or so to make sure that I can move the band open and close so food can pass through it. So it can't be liquids. It's got to be something that can move it and exercise it. Because what happens if you don't, then the scar tissue will form around it and basically keep it there really tight so that you can't eat anything and it gets stuck. Um, I tried to take a pill yesterday without having anything more than just some water to take it down, and it caused spasming because my LINX wasn't going to open, and so it kind of got stuck for a while, and I was hiccuping, and that's painful. It hurt. um, I am very sore. It was laparoscopic surgery, and so they blow up your stomach so they can see better. But that means that you're left with some gas that gets trapped in like your shoulders, hence the heating pad that you can see here, and in your stomach. So that's painful. So I'm trying to walk and use my heating pad. My esophagus area that they repaired, I mean, it's very sore. When I try to take deep breaths, which I need to because it helps prevent pneumonia, and I don't want that, it hurts because, my esophagus was repaired and was messed with. So I do my best to do it slowly, but it is quite painful. Um, it's interesting because I've had so many of these other surgeries that you'd think that I wouldn't be quite as bad as far as pain is concerned, but it's different because it's internal. And I don't know. I maybe I'm just more sensitive when it comes to internal stuff than external, but the gas pain is pretty bad. I'm not a huge fan of that, but it is getting better slowly. I just have to take it easy. Uh, Pretty much been resting since we got home yesterday and be resting today. Um, I have been eating crackers and applesauce. I had a little bit of grits earlier. Um, Yogurt. I'm trying to start with soft stuff before I move into something a little bit more solid, trying to keep my protein up. But that's what I'm dealing with. I will do a few updates just to let you know how it goes. I'm not nauseated. I don't have headaches, none of that stuff. So it's just kind of a taking it slow process. And I will update you probably tomorrow. Bye.